FAST acronym for stroke recognition. The FAST acronym is a critical tool for rapid stroke recognition and timely intervention in emergency settings. Overview. Stroke is a sudden disruption of blood flow to the brain, leading to neuronal damage and potential death. The FAST acronym is a widely used mnemonic for rapid stroke recognition, emphasizing the importance of early intervention. It stands for F, face drooping, A, arm weakness, S, speech disturbance, and T, time to call emergency services. The goal of FAST is to identify stroke symptoms quickly and prompt timely medical care. Pathophysiology/mechanism of action. Stroke occurs when there is an acute disruption of blood flow to the brain, either due to thrombosis, blood clot, or hemorrhage, bleeding. The most common type is ischemic stroke, accounting for approximately 85% of all strokes. Ischemic strokes occur when a blood clot forms in a blood vessel near the brain and blocks the flow of blood to a part of the brain. Hemorrhagic strokes, which account for about 15% of strokes, occur when a blood vessel in the brain ruptures, causing blood to leak into the brain tissue. The mechanism of action of stroke management involves rapid assessment, immediate intervention, and stabilization of the patient. Early recognition and treatment are crucial to minimize brain damage and improve patient outcomes. Clinical features/indications. The clinical features of a stroke include sudden onset of symptoms, such as facial drooping, arm weakness, speech difficulties, and sudden severe headache. These symptoms are often accompanied by altered consciousness, confusion, or visual disturbances. The indications for stroke management include the presence of any of the above symptoms, along with a history of risk factors such as hypertension, diabetes, smoking, or atrial fibrillation. Diagnosis/monitoring. Diagnosis of stroke is typically performed using a combination of clinical assessment and imaging. The initial assessment includes a rapid neurological exam to identify the type of stroke and the extent of brain damage. Imaging studies such as CT scans and MRI are used to confirm the diagnosis and determine the location and severity of the stroke. In the case of an ischemic stroke, a CT scan may show a hyperdense image, while a MRI with perfusion studies can help differentiate between ischemic and hemorrhagic strokes. Monitoring of stroke patients involves tracking vital signs, neurological status, and laboratory values such as blood pressure, heart rate, and electrolyte levels. Continuous monitoring is essential to detect any changes in the patient's condition and to guide treatment decisions. Treatment/management. The management of stroke involves several key steps: rapid assessment, immediate intervention, and long-term care. For acute stroke management, the primary goal is to reduce brain injury and prevent further complications. This includes administering thrombolytic therapy, such as alteplase, within the first few hours of symptom onset, if appropriate. However, this therapy is not universally applicable due to the risk of bleeding and the need for patient eligibility criteria. In addition to medical treatment, stroke management also involves supportive care, including oxygen therapy, intravenous fluids, and anticoagulation therapy. For hemorrhagic strokes, surgical intervention may be necessary to remove blood clots or repair ruptured blood vessels. The management of stroke is a multidisciplinary effort involving neurologists, intensivists, and other healthcare professionals. Key clinical points. Key points. The FAST acronym is a vital tool for rapid stroke recognition and early intervention. Early recognition and treatment of stroke significantly improve patient outcomes. Stroke management involves a combination of acute intervention, supportive care, and long-term follow-up. Rapid assessment and imaging are essential for accurate diagnosis and treatment planning. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.